Welcome to another episode of Holistic Approaches, our weekly show about holistic weight loss. I'm your host, Dr. David Duizer. Thank you so much for tuning in. A special shout out to everyone who joined the DAMY Lean after last week's episode. So happy to be on the journey with you, and thanks so much for joining. An extra special shout out if this is your first time watching our show. This is our weekly holistic weight loss show, and we're so happy to have you. Thanks for tuning in. The topic of today's show is the 3 keys to overcoming estrogen dominance and weight gain. The purpose of the show Holistic Approaches is to highlight how effective the holistic approach to weight loss can actually be. Traditional approaches to weight loss have been based on intense calorie restriction and significant increases in exercise, and we know those don't work for everyone. The holistic approach is more specific and has a better chance of success for most, especially for those who haven't had success with those traditional approaches of intense restriction and intense exercise. The goal of this series is to highlight how the holistic approach can work for you. We cover a different topic each week. This week we're talking about high estrogen levels and how they can cause weight gain, and then subsequently how can we reduce them naturally so that weight loss is much easier. Again, my name is Dr. David Duizer. I'm the medical director here at DAMY Health. I'm a private practice naturopathic doctor in Vancouver, British Columbia at the Finlandia Health Center. My clinical practice is focused on the integrative approach to chronic disease management and functional integrative cancer care. In addition to holistic weight loss, we know that weight gain is a risk factor for many different diseases, including 12 different types of cancer. So we are aggressively trying to help people maintain an appropriate body weight through the holistic approach to weight loss. And what a better way to do that than through the principles of naturopathic medicine. So today we're talking about estrogen dominance and weight gain and how to overcome it. So first of all, what is estrogen dominance? Well, estrogen dominance is when your ratio between estrogen and progesterone is far too high on the estrogen side. And this can happen, usually this is happening premenopausally or during the transition through menopause. The symptoms are usually premenstrual type symptoms. So in the second half of your cycle, usually there'll be some sort of symptomology that indicates that estrogen is far too high in relationship to progesterone. This can the symptoms of this can be things like lower abdominal pain, breast tenderness, irritability, poor mood in general, acne, a series of issues. It can cause digestive change, it can cause insomnia, but the only way really to diagnose would be through a hormone level test. We do saliva testing here in the clinic. We also do urine testing. The difference being, the benefit of urine testing is that you can get the different levels of estrogens, or the different levels of the different types of estrogens, so you can see which is highest for you in relationship to progesterone as well. So we do saliva testing for all of these, but urine testing can give you the metabolites of your detoxification of each type of estrogen. It can give you your methylation ability for the metabolites of your detoxification of estrogen. A very complex system of measurements. But the point here is that even just in the second half of the cycle, a basic estrogen-progesterone ratio could be helpful. So we're usually doing that. Sometimes we just go based on symptoms if someone really fits the picture. So how does estrogen dominance contribute to weight gain? Well, people with estrogen dominance normally will experience increases in fat storage on their hips. So it's kind of that fat storage mode of laying fat down on the hips in combination with cycle irregularities would indicate that there's potentially high estrogen here, and we should actively try and reduce it. So estrogen normally has been known as it's an androgenic hormone. It should be helpful in weight reduction, but we know it also helps to sensitize the cells to blood sugar. So it can be good for blood sugar control. But we know when it goes too high, it alters the metabolism of fat in that hip region, and therefore you store more fat in that area. So how do we fix it? Well, there are 3 keys that we'll cover today. So number 1, we usually start with diet. It's very helpful to be following a very specific estrogen reduction diet protocol when you're experiencing estrogen dominance. The foods that we tend to increase are cruciferous veggies like broccoli, cauliflower, Brussels sprouts, and kale, and we take those levels higher, and people tend to do better. It upregulates enzymes in the liver that help with the detoxification of estrogen. We also use phytoestrogens like flax, and premenopausally we use soy as well. So those types of phytoestrogens can take up the receptors for your very, very androgenic estrogens, and therefore reduce the impact of your estrogen levels on cellular metabolism. So flax can also help with the detoxification of estrogen through the stool. So we know it helps bind hormone in the stool and bulk your stool up so that you can better clear hormones and the metabolites of hormones. If you don't clear hormones well, if you're not having bowel movements every day, they can go back, they can be reabsorbed and go back into the circulation when they're passing through the digestive tract. So you need to make sure you're clearing them. So that's kind of the diet route. We upregulate cruciferous vegetables. Sometimes we'll recommend I3C and DIM and calcium D-glucarate. I3C is the actual nutraceutical that we use. It's the component of the cruciferous veggies that then creates DIM, that then causes an increase in estrogen detoxification and lowers your levels. It's pretty good. When it's used in improper situations, for example, if it's someone who has a low estrogen state, if like in menopause, if you give them I3C or DIM, they're probably going to have a severe hot flash because it really does work. So it's effective, but we start with just food and move forward from there and see what we need. The common misconceptions here, without testing, people will sometimes say, I haven't been exposed to any estrogens. I've never taken estrogen cream. I don't have all of the symptoms to fit the picture. Am I really estrogen dominant? Sometimes people are. Genetically, there is the potential for poor detoxification of estrogen, regardless of the type of lifestyle you live, regardless of the type of foods you eat. Another misconception here is, I eat lots of these vegetables, yet I still have these symptoms. Do you think it's still estrogen? It very well can be. And the genetic mechanisms for this are really outlined functionally in this Dutch panel that I use, which I was saying how it gives all the different metabolites of estrogen and the methylation ability. There are certain stages in the detoxification process where if you have one genetic change, all of a sudden you can be storing or putting back into circulation metabolites of estrogen or estrogen itself. So genetically, people are just different. And you can see that with, we think that people who have fibrocystic breasts, for example, are more commonly in a high estrogen state. It doesn't have anything to do with their lifestyle, it's genetic. So something to consider. We really know this protocol is effective because we have had experiences without testing where we've been wrong and have given this type of diet and have given these types of nutraceuticals and seen the side effects of hot flashes, seen the side effects of aggressive estrogen suppression. You're seeing that now with people who are taking high doses of sulforaphane. Sometimes it's not necessary and it's just far too effective, and all of a sudden people are getting hot flashes and night sweats when really they're nowhere near menopause. It's because they're too effective and we have to cut the dose. So we know these are effective. We do follow up lab tests and we do see ratios improve. We do see symptoms calm down. And when we do this, we often see weight loss efforts improve when there has been significant plateaus. If this is the cause, this protocol does work. The second key to reducing estrogen dominance symptoms and levels would be to adopt a detoxification type of lifestyle, to adopt a lifestyle that supports your ability to clear excess hormone, your ability to reduce the metabolic burden of having to detox so much estrogen. Now, this lifestyle could include things like sauna, it could include things like exercise, it should include things like water and stress reduction. We know that people who are stressed tend to clear hormone worse. People will report stress often makes their cycle worse. People will report, we know that stress hormones can affect the utilization of female hormones. So, a healthy lifestyle is very important. These lifestyle activities I'm mentioning are really detoxification activities. When you exercise, you use up your androgens. Your liver detoxification is improved. You're just better able to clear metabolites. We know that people pass stool better when they exercise. People hydrate themselves better when they're exercising. Stress reduction is easier when people are exercising. So all these things help with the detoxification of high estrogens. Sauna, for example, causes you to sweat. It challenges the body. In doing so, it causes the body to upregulate its detoxification capacity. The other thing would be fiber and water. We know those things are helpful for moving through things like metabolites of estrogen, so the body can better clear them. A common misconception here, very similar to the previous. I do all these things. What the heck is going on? Well, again, could be genetic. Could be also that there are other things causing issue. For example, if you're doing all of these things but you're still not having a bowel movement because you have constipation from hypothyroidism, or you have a stricture, or you have some reason for your inability to pass a stool, you're going to become toxic pretty quickly. So there are other potentials along this line of holistic thinking that could reduce the detoxification pathway. Another thing could be that you're being exposed to estrogens, whether it be on the seat at the gym. You could be going right after someone each week who's using estrogen creams. You could be consuming foods that are in plastics, BPA type plastics. You could be in an environment with high phthalates or parabens. You could be, all of these things are estrogenic in nature and could be causing high estrogen-like symptoms, even though you're living a healthy lifestyle. If you're just being exposed to this type of estrogenic compounds every single day, then it's possible they could be the culprit of your estrogen dominance. So, we do things like these toxification testings, the toxicity testing, just to see if the environment is having a negative impact on the body. And sometimes those are very helpful. So, we have had cases in the past where we have not been able to figure out exactly why there's estrogen dominance symptoms, even though estrogen levels have been fine, yet the fat development on the hips occurred, and the premenstrual symptoms were there. And we tested these types of toxicities and seen them being high, and then detoxifying them is actually very effective. The other thing in this category that I should mention would be things like antioxidant therapy and methylation capacity. If there is this genetic defect in causing the inability to clear the metabolites of estrogen detoxification, then your antioxidants could be low. Your methylation capacity could be low. And when that occurs, we have to do things to override, to practice epigenetically, to go beyond the genetic expression, to help clear estrogen metabolites and to help methylate those end products better. So in doing that, we're doing things like, glutathione sometimes. We're doing N-acetylcysteine, a precursor to glutathione, alpha-lipoic acid, CoQ10, a bunch of different things. When the methylation capacity, we're doing methyl B12, methyl B9, so methylcobalamin, MTHF. When we have to do those, we do them. So we would do genetic testing to figure that out usually. And when we do it, it's just very helpful. It's pretty much every single time we see benefit from doing that. So estrogen dominance can be more than just a genetic inability to clear estrogen, more than just estrogen exposure. It could be one or a multitude of things. The third key to reducing estrogen dominance would be to figure out through the hormone testing whether or not it's actually high estrogen and normal progesterone, or normal estrogen, low progesterone. Because if it's in the second half of your cycle, it's low progesterone, then you have estrogen dominance still, but clearing estrogen is not going to help. It's going to send you into a low hormone state. You need to boost progesterone levels. And we would use herbs to do that. Sometimes we would actually use bioidentical hormones, even premenopausally. Even just 14 days, second half of the cycle, a little bit of cream on the wrist each night can be helpful in bringing that progesterone level up, and then estrogen dominant symptoms can come down. We've got tons and tons of cases of this, of healthy young women who have inability to lose weight, with significant estrogen dominant symptoms, and then you bring up the progesterone and they just lose weight a lot easier. So the only way to do that would be through testing. We don't like to prescribe. We really shouldn't be prescribing progesterone without testing. Doing anything that requires the medication, we would like to know the levels before going forward. So these are things you can ask your family doctor, your naturopath for. I should mention that, don't take anything from this Holistic Approaches episode as medical advice. Please consult your naturopath or MD before moving forward with anything. You want to make sure you get a good picture of where you stand before moving on. These symptoms can all occur really in a series of different holistic blocks to weight loss. For example, thyroid, stress, all these things. If we're not checking all of those at the same time, we might be correcting one system or treating one system without knowing what else is going on. Also, on this low progesterone, normal estrogen topic, there are some misconceptions that we should cover. First off, the misconception that bioidentical hormones cause cancer. It's true for the nurses study from the 90s when they were giving the synthetic horse urine estrogen from to women who didn't need it. They were giving it to women in their 50s, 60s, and 70s. The women in their 60s and 70s definitely developed heart disease and cancer from the synthetic estrogen they were given. Since that time, we have been doing bioidentical prescribing. Even the specialists and the family docs as well have been doing bioidentical versions of the hormones that are used, and also being very specific about using progesterone oral progesterone when someone is doing estrogen therapy to make sure the hormones are in balance, and not just doing estrogen on its own if someone still has an intact uterus. So we've learned a lot since the 90s, and the bioidentical hormones, specifically progesterone, are considered very safe, although you'll want to ask your medical provider about pros and cons before starting. But it is really, really, really a misconception that bioidentical hormones cause cancer, because they don't. If you have high estrogen and then you take extra estrogen, and estrogen positive hormone cancers are in your family, there's a potential that you could get cancer from that. But that practice is never done. Usually the proper steps are followed to make sure that occurrence does not happen. So whenever there is a risk of estrogen positive cancers, we're usually recommending that we test, and then if progesterone's low, providing progesterone in prevention therapy. And that's just something that's practiced, and there's good rationale behind that. So we like to do that. So those are really the three keys to reducing estrogen dominance in estrogen dominant weight gain. Keeping the diet clean, adding cruciferous veggies and some ground flax, sometimes phytoestrogens if you're premenopausal. Controversy there, but premenopausally we like them, we think they're beneficial. Secondary, keeping your lifestyle intact. Sauna, exercise, water, fiber. Make sure the body's functioning properly so they can properly detoxify estrogens. Sometimes you need a genetic test. Sometimes you need a complete hormone panel that includes metabolites of hormone detox and methylation capacity, if you don't see benefit from the first line of therapy. And then finally, figuring out if it's actually estrogen dominance from high estrogen or estrogen dominance from normal estrogen and low progesterone. Because if it's low progesterone, that's a simple fix, and you don't have to touch the estrogen levels. You don't need to do the diet changes. And that one's really, really easy, really quick to fix. That's Holistic Approaches for today. Thank you so much for watching. If you enjoyed today's show, please let me know in the comments below. If you have a question for next week, if you have a topic you'd like me to cover, please ask it in the comments below. We thank you so much for watching. I'd like to take a few minutes to just go over a few things about the DAMY Lean program. DAMY Lean program is split into two categories. First category is a module-based video program consisting of 10 modules. The holistic approach to weight loss that we use, that we follow, that we recommend. It's the first 4 modules are basic. The DAMY Lean mindset, the nutrition for weight loss, fitness for weight loss, and of course intermittent fasting on a holistic approach. And then 6 more modules I won't mention. Those are all video and text-based modules. And then the second half of the program is the holistic approach to weight loss, where you do a do-it-yourself, you follow a do-it-yourself guide through the holistic blocks that could be causing your inability to lose weight. estrogen dominance is on there. If you fit the symptom picture, following the guide that's included could be helpful in improving your weight loss capacity. So that's Holistic Approaches for today. That's the short description of the DAMY Lean I like to provide. If you would like to learn more about the DAMY Lean, go to damyhealth.com/join. Lots of info up there about the program. It's a monthly program, $49 per month. Every week I do a Lean Live for members only on the DAMY Lean Facebook group. So if you're a member and you haven't checked out the Lean Live, it's Tuesdays at 2 Pacific. Check it out. We post it to the portal after each episode. And so grateful to be able to do Q&As every week with members only. So yeah, just really excited about the program in general. Thanks so much for watching. That's Holistic Approaches for today. Hope you have a really great week. And we will see you next week. Have a good weekend.